Hi, I'm Colin Hung, editor at Healthcare IT Today. And I'm sitting down right now with David Cates, CTO of Manifest MedEx, an HIE with about 8 million lives under management.
Correct.
David, thank you for sitting down with me today.
Thanks, good morning.
Good morning. So, David, talk to me a little bit about the work you're doing with CareCom and their HealthTerm terminology services solution.
Sure, so Manifest MedEx established the technology platform that we're now operating on and went live last October 17th. And incorporated in that is a clinical data repository and a bunch of transaction formatting tools, interface engine, and EMPI. Alongside those components, CareCom is a critical component of the infrastructure that we've built in terms of normalizing and standardizing the terminology that we get from the various hospital and health plan participants. So as we get information from organizations to feed our longitudinal patient record, CareCom becomes a critical component of that in terms of standardizing the information and the descriptions that we display to clinicians, care managers, health plan members that are leveraging our technology.
Wow, that sounds really complicated. So can you maybe walk me through the implementation of of HealthTerm with CareCom and how that all went?
Sure, it went great. So we began the beginning part of 2017, beginning part of 2018, after evaluating a number of different technology partners, and decided to host our technology in the Amazon Web Services cloud. So we, working with CareCom and our other technology partners, deployed that technology in the early part of 2018, stood that up, and CareCom was a great partner in terms of being able to go and host the terminology services in the cloud and support the transaction flow that I described a moment ago. So as we started building, migrating historical data that we had from a previous generation of technology, we ran it through the CareCom terminology services to, again, take coded values and come up with standardized descriptions. And likewise, as transactions, HL7 messages with lab results and meds coming in, we apply the CareCom technology to then standardize the descriptions and the like. So as clinicians are seeing different meds, different labs across different organizations, they can, that's all normalized in a way so that they can make informed clinical decisions.
Excellent. And so you said it was very easy to work with CareCom and the team there? They're really knowledgeable?
It was. I mean, everything from understanding how to leverage the APIs that our interface engine and that our clinical data repository use from a technical standpoint, and even just, some of the twists and turns along during the implementation. So we had a massive amount of transactions that we were feeding through, 2 years of history, years of transactions. And so from a volume standpoint, CareCom was enormously helpful and responsive when we needed to improve the performance, scale the terminology service, establish, one of the benefits of the cloud of being able to go and stand up additional servers. CareCom was right at our side in terms of being able to go and work collaboratively in order to accomplish the goals to get the system live in October and on an ongoing basis to support the volume of transactions that we're processing through the system.
Wow. So talk to me a little bit, David, around what's the impact that all of this has had on the lives that you manage and the patients themselves? What does all of this do for them?
Sure. The primary stakeholders or constituents that are leveraging our technology are the doctors and care managers and caregivers across the state of California that are making informed decisions about the care they're delivering to their patients. And with Manifest MedEx, they have access to this longitudinal patient record that spans all the care settings in the state. And as we were discussing before we started, we're also going to be, in the next few weeks, adding claims data to fill in some of the holes and to add some specific details. As a result, the caregivers have a complete view of the care that's been delivered to the patient and can make informed decisions to deliver cost-effective quality care for the citizens of California and the patients that they care for. Similarly, the health plans and other constituents across the state can leverage that data in order to, again, see the complete picture of the care that's been delivered to this person to deliver the most cost-effective quality care.
Excellent. Well, David, thank you so much for sitting down with me today. I've learned a lot, and it sounds like you're doing such amazing work, so thank you so much.
Great, my pleasure. Thank you.